Hello everyone, this is Dylan in Career Services, and today we are going to talk about resumes specifically for medical assistants. So without further ado, let's check out a resume template for an entry-level medical assistant. The first thing that we're obviously going to start with, and we discussed this in the previous webinar, is your contact information. That's obviously going to start with your first and last name. And then beneath that, you're going to put the city and state where you currently reside. As we did discuss previously, we are no longer utilizing street addresses for our students and graduates, just to maintain your privacy. So you are only going to put the city and state where you currently reside. There's no need for a zip code either. Underneath the city and state, you are going to list your phone number or phone numbers. In most cases, this day and age, the majority of us are utilizing our cell phones. So if that's the primary number that you utilize, then feel free to just list that. But if you do check both home and cell phone frequently, then feel free to list both. The thing that we're trying to avoid is people listing their home phones when they only check their voice messages once a week or even less frequently in some cases. We just want to make sure that employers aren't leaving messages on that number if it's not something that you check frequently. Underneath your phone number, you are going to put your professional email address. Again, I can't emphasize this enough. Please make sure that the email that you list on your resume is professional. So that would be something like your first name hyphen last name at gmail.com. That would be absolutely fine. Once you're done with your contact information, you are going to start with your positioning statement. If you'll remember from the first webinar, the purpose of the positioning statement is to increase marketability and visibility with employers, and it contains three basic components: your character traits, professional identity, and summary. So the example that we use on this resume is resourceful, detail-oriented, and trustworthy healthcare provider, practiced in patient intake and medical record management, and a track record of exceeding service expectations. So it's simple and to the point, and it describes this individual as a professional. Just to reiterate, this is a sample template for what would be an entry-level candidate. We assume that the majority of our students and graduates, when you are applying for your eventual internships or jobs, are going to have very little to no experience or previous experience in the medical assisting field or allied health field. So for that reason, we're going to start with education as our first section on the resume. And you will obviously put Berkeley College, and then you're going to put the location of your campus. So for this example, it's Woodland Park. Then you're going to list your program, which is obviously medical assistant. Underneath that, you're more than welcome to list your GPA as well as any special awards such as President's List or Dean's List. You'll see that the GPA listed here is 4.0, which is outstanding. What we typically recommend to students and grads is don't list your GPA if it is below a 3.7. That's not to say that any GPA below 3.7 is necessarily bad. It's just that once you start listing your GPA, then you're leaving yourself open to it being critiqued a little bit more by potential employers. Underneath your Berkeley College information, you'll see that this particular resume also lists a course structure for the medical assistant program. This is optional in most cases and depends greatly on the level of experience that you do have. If you have someone who has more of a vast previous experience, then we typically say leave off the course structure because it does typically act as more of a filler than anything else. But if you are someone who's got very little to no previous experience, then you might want to list the course structure just so any potential employers can see exactly what your curriculum currently consists of. Underneath education, you are going to next list your internship information. Again, this resume should be completed before you actually go out on your internships. So you'll see that this one actually says to be determined. And then underneath that, it says must complete 165 hours of clinical and administrative functions under the direct supervision of the physician and staff. This is important when we're sending this out to potential internship sites. So that way it just reminds them of exactly how many hours you're going to need to complete for your internship. Underneath your internship section, you will see that we next list your certifications. All of you will need your CPR certification in order to go on to your internship. So that will be vital to list. So you're going to list CPR as well as the expiration date. Many of you will also have your EKG and phlebotomy certifications as well, so you're more than welcome to list those. If for some reason you have not taken, for instance, your phlebotomy exam, but it is scheduled, then you can just put pending. Underneath your certifications, there will be a skills section. This is where you're going to list anything like Microsoft Office or Microsoft Word or Excel, as well as any previous medical office software that you've utilized, or even medical office simulation software that you've utilized. It's important to note also, if you have utilized other software or programs in previous job experience, and it's not necessarily related to the allied health field, it's absolutely fine to list that here as well, because it does show potential employers that you are easily trainable on that software, and you are able to pick it up quite easily. And underneath skills, this is where you will put your employment section. Just remember, with regard to employment and education, you are always working in reverse chronological order. So you're going to work with your most recent experience or your current experience and work backwards from there. So the example on this resume is Qualpack America. That's located in Wayne, New Jersey. And the dates of employment are January 2012 to present. That's why it's the first one listed. And then the job title is Tool Room Manager. Once you complete that information, you're going to want to list 4 or 5 bullet points about what your roles and responsibilities are at this job. So in this case, it's interview and hire new employees, manage 3 employees, develop work schedules. Just make sure that when you are filling out your employment information, you're using the current or the correct current or past tense for your action words, and that's based on whether you're still at that location or not. So in this case, you'll see that everything is in present tense for Qualpack because this person is still currently employed there. So it says interview and hire new employees. If they were no longer there or worked there a couple of years ago but are no longer working there, then everything would be in past tense. It would then say interviewed and hired new employees. So after you've completed your employment information, then there's typically room on the bottom to list anything such as awards as well as languages. So for awards, the example that they use in this sample resume is Employee of the Month at Qualpack, which again would be a nice something nice to put down because it shows that you're highly regarded at your current place of employment. I know Berkeley College also does something like a Student of the Semester. So if you've either been nominated for that or selected for that, then that might be something else that you put in this section as well. And then you will have a languages section if you speak multiple languages. So in this case, it says bilingual, English and Spanish. If you're like me and you just speak English, then you're not going to have a language section at all. So again, I'd just like to reiterate that this is an entry-level resume. If you do have previous experience in the allied health field, then that might actually force you to change your resume around a little bit. The information won't necessarily change, but you might just want to change the order with which you're presenting everything. So if you have, for instance, previous front office experience at a doctor's office, then you might actually want to list your employment information first and then put your education after that. With that said, if you do have any questions about your resume, or if you do need help structuring your resume, you can always contact me directly to set up a separate appointment. And you can reach me at my phone number, which is 973-366-6700, extension 5641, or via email at dgd@berkeleycollege.edu. And with that said, that concludes our webinar for resumes for medical assistants. Thank you very much for your time, and I look forward to working with all of you.